Okay, so why don't we get started? Good evening, everyone. Can you hear me? Yes, I guess you can, right, because we have everybody on mute, so excellent. So welcome to our WebEx call this evening. This is Maureen Wennick, the Director of Programs and Research at the Foundation for Ichthyosis. I'm glad that we have you on the call tonight or on the WebEx this evening. This topic this evening is regarding clean skincare. And we're really excited to have Dr. Anwar, Dr. Silverman on the call this evening to talk to you further about this product. And we hope that you get a lot out of it. And feel free at the end, we're going to hold questions until the end of our presentation. So if you have questions, you can jot them down. Or if you wanted to even probably put them in the chat, you can put them in the chat so you know, they can at least be in queue. So the agenda tonight is obviously introductions, and I'm going to give you some first updates. And I'm going to turn the meeting over to Maddie Bergman, and she will then introduce Dr. Anwar, Dr. Silverman, and then we will turn that over to them to present. So we were talking earlier with some of our members that we are having patient support forums. These are one-day meetings. We are actually really happy to be able to be traveling across the country and Canada to present a one-day event. We have a medical session in the morning, followed with some networking in the afternoon, some other programming depending on what city we're in. The information can be found on our website at firstskinfoundation.org, and you can also register through there. When you get to First Skin, if you want to go down to Ways to Connect and Patient Support Forums, and you could find the meeting that is by you. You do not have to live in the region to attend a meeting. You can attend a meeting anywhere in the United States. So I hope that you will consider attending this event, and I'll have a chance to meet you, and you can meet others with ichthyosis. The other program that I'd like to tell you about is very similar to what we do tonight, except it's a telephone call, not a WebEx call, and they're called First to Know. The topics are on specific ichthyosis types, and then we do have one that is talking about the benefits of attending the national conference, which is in June of 2018. So again, you could go to the website, click on the link, and register. It's, again, a one-hour phone call. They're held on Sundays from 8 to 9 Eastern Time. We find these very beneficial, and hopefully you'll join in on one of those calls as well. And national conference, if you have never attended one of our national conferences, I highly recommend it. Nashville is our city for the 2018 biennial conference. It is a great weekend. We have research component, we have networking, we have breakout sessions, there's a fun dinner dance. This is an amazing opportunity to come out and meet more families, to learn more. If you have not been to a national conference, I encourage you to attend. Additionally, if you want to get on that First to Know call to find out more, please do. And we just want to make sure that you will be informed and hopefully coming to Nashville. We're really excited. And I want to turn the meeting over to Maddie Bergman, our Director of Development. Thank you.
Great. So thanks, Mo. Tomorrow kicks off May 1st, which is Ichthyosis Awareness Month. So it's a big month for the ichthyosis community and for FIRST. So there's a couple ways that you guys can celebrate. And Monday is also kicking off our national fundraiser called I Am First. So with this fundraiser, we're asking you to raise awareness and advocate for the ichthyosis community by hosting a fundraiser in your community. And we'll set you up with a personal donation page where you can just pledge to have a big sale, you know, invite some friends over for dinner, or just send out some fundraising emails asking your friends, family, friends of friends to support FIRST and why FIRST is very important to you. So our goal this year for our national fundraiser is $65,000, and we already have a couple people registered and starting to fundraise, so I hope that you guys will join us. And the money that you raise will help support programs like the one we're having tonight, our patient support forums, our national conference, really the heart of our community. And we also are having a global ichthyosis awareness movement where we're partnering with other ichthyosis support groups throughout the world, Europe, the UK. And so we're asking you, if you're on social media, to take a selfie with your flag or maybe a monument in your area and post it on our global Facebook page, and then using the hashtag Ichthyosis Awareness Month. So we've already seen a couple of photos up there, and it's really cool just to see across the globe, where we're raising awareness for ichthyosis. And let's get to the heart of the conversation tonight. We're really excited to have Dr. Anwar and Dr. Silverman joining us tonight. I'm just going to give you a little brief background on Dr. Anwar and Dr. Silverman, and then they can take it over. But Dr. Anwar has been, was a cardiologist and started Cln, and is a very strong supporter of the FIRST community and has some great products that we're excited for you guys to learn about. Dr. Silverman is a dermatologist out of Virginia, and he is a very dear supporter of FIRST as well, serving on our board of directors and then also our medical and scientific advisory board. So thank you, Dr. Anwar and Dr. Silverman, for taking some time to speak with us tonight. And Dr. Anwar, I will now turn it over to you.
Thank you very much. It's an honor to be on the call today, and I can tell everyone listening that I'm very impressed with the FIRST Foundation team and the management. They work tirelessly for you, and they sought us out. We've met at several meetings and been very happy to work with the team. We've also provided some samples for the FIRST Foundation members in some format in the past, and I myself became interested in skin diseases. I'm a cardiologist, but had a skin infection, a MRSA cellulitis on my shin a number of years ago, and was treated with antibiotics, and my dermatologist recommended bleach baths and Cln washes, and I found that the bleach baths were useful but cumbersome. So I know which those of you who have to use a bleach bath, what you go through, and then the Cln washes were a little bit drying for me. As we've gone through the development of our product, we've worked with Pediatric Dermatologist, and Dr. Silverman and I have become friends through this project, and he's been very instrumental in helping us advance our products into pediatric dermatology and dermatology. And I also happen to work with Dr. Amy Powler, who did some of our original research on eczema patients. So as one that suffered from a skin problem, I can imagine what you go through when the physicians ask you to use a variety of remedies that they may have not used themselves. Can we go to the next slide, please? Next. So I basically went over this slide, and I also realized that in the medical community we rely heavily on antibiotics and steroids, and often skin cleansing is not really regarded as a first step, and we want to change that at CLN or Cln. Next slide, please. Next. It turns out that nearly 100 million people suffer from various types of skin problems, from eczema to ichthyosis, problems that athletes get, such as athlete's foot or folliculitis. Again, all of this is related to a combination of the skin being compromised in some way, either internally or exogenously, and then microbes at times may play a role where there may be infection or smell. One of the best things that you can do is really use a bleach bath. A bleach bath, for those of you who may have not used it, basically take a quarter cup of Clorox and put it in half a tub of water, which is essentially diluting the Clorox or bleach 1,000-fold. So it's very, very diluted. And it turns out to be antimicrobial, kills bacteria and fungi. It's anti-inflammatory, reduces inflammation. It's been useful in eczema. And also it turns out to be anti-aging. So it has a lot of benefits, but it's really, quite cumbersome to use. Next slide. So as I studied bleach baths as a user myself, I saw a lot of benefits, but also the limitations. And additionally, you can't really use it above the head and neck area. So we formed a group of scientists and physicians and said, can we create a product that you could use in the shower where you wet the skin and lather this product on, which would be elegant, easy to use, and rinse it off, where it will essentially be as effective or actually better than a bleach bath. Bleach bath, as you know, you have to rinse off. There's a little bit of smell to it, and it can also be drying to the skin, and you can't use it above the head and neck area. So I think we accomplished that by producing Cln. It's patented in the U.S. and other countries, and it's been in the market for a few years, and through our networking we found that certain populations of ichthyosis may benefit from it. And Dr. Silverman will speak more about that. Next slide, please. The product is really quite easy to use. It's a gel cleanser. You wet the skin, turn the water off, completely wet the skin, I should say, in the shower, and then just use your hands to foam the product onto the skin, hair, nails. And we saw the best benefit of this by applying the product for about 2 minutes onto the skin. And the reason for 2 minutes is that the killing of the staph bacteria is better at 2 minutes than 1 minute, and it's actually even more at 3 and 5 minutes. So the longer you can put it on the skin, the more bacteria the product will kill. You can use it in the hair, nails. Obviously, we don't want to get in the mouth or eyes. You want to close your eyes there. And then you thoroughly rinse it off and use any other product that you would need afterwards. We do not recommend using a washcloth because it absorbs a lot of the soap, but you could use a scrubber or a nylon loofah. And after using the product, you can apply your moisturizer, steroids, or whatever else you really need to use for your routine. So essentially, it's a gel soap that you put on the wet skin. The only difference would be that you would leave it on and lather onto the skin about 2 minutes. Next slide. We brought the product to the dermatology community through the pediatric dermatologist, and Dr. Silverman is also a pediatric dermatologist. They deal with a group of patients with eczema, and eczema often is driven by staph bacteria. So we did a study in children with staph bacteria colonization of their eczema, and the initial feasibility showed very good results in 18 patients. And in these patients, no antibiotics were used, no bleach baths were used, and 9 out of 10 people would recommend it to others, and there was significant improvement of the skin, the rash, the redness, itching, etc. We were heartened by the study, and then we did a second study. Next slide, please. This was here's a before and after. Here's a child, a 2-year-old who'd been on antibiotics for at one time for 42 days in a row. She almost lost a toe because of the recurrent infections. Was hospitalized for IV antibiotics on multiple times because of her eczema and staph infections. And then really after starting using Cln, she was dramatically better and has really had no bouts of infections for the last 5 years, and is a happy 7-year-old at this time going to school, and actually self-manages her eczema. Next slide. We did a second study in Houston and Chicago at Northwestern with Dr. Paller, 25 patients in each group. Again, children with eczema, with staph bacteria on their skin. By culture, they used the product just as I described earlier for 6 weeks, and again, no antibiotics are used. We noted that the skin improved dramatically, the itching was reduced, and the quality of life for the parent and child were improved, and they saw a trend towards reduced usage of steroids, and the staph bacteria on the skin was also reduced. So this was a nice confirmatory study, and because of these 2 studies, Cln is now used fairly routinely in the eczema population around the country. Next slide, please. Here's some before and afters. A child with a lot of eczema in the palm. Anytime you see these red little spots, these cuts, there's bacteria, there's staph bacteria in there. And then after 6 weeks, you can see the palm is dramatically improved. And the heartening thing about this is a very simple gel wash, which gives you these kind of benefits. Here at the lower left-hand picture, there's again eczema, back of the leg, very crusty, itchy, irritated, open lesions with staph bacteria in it, and dramatic improvement within a few weeks. And some of the kids actually started getting better after 3 washes. So very early benefits can be seen. And this population actually also responds quite well to bleach baths. Next slide. So in summary, this second study showed that without antibiotics, the patients improved. The safety was really, quite good. Itching was reduced. The skin improved. Quality of life improved. And steroid usage was reduced, and bacteria on the skin was reduced as well. Next slide. I'm going to turn the discussion over to Dr. Silverman. We have a picture of the entire product line, and then from what I understand, the First Foundation team has told me that the body wash, the Clean Body Wash, and the Cln Shampoo are the products that the ichthyosis community can benefit the most with. And I am not an expert on ichthyosis. Dr. Silverman is. So, Bob, I'd love to learn more from you.
Okay, I'm calling in through the cell phone. It doesn't sound like that anyone is.
Oh, Bob,
hello?
Hi, Bob, we can hear you.
There we go. Okay, I must have been muted. Can you hear me now?
Yes, we are good.
Well, thank you very much for that, the introduction, and Dr. Anwar, thank you very much for coming up with this product for our patients with atopic dermatitis, with folliculitis, and with many other skin conditions that are worsened or prolonged by the overabundance of this germ called Staph aureus. Before I start, I was wondering, Dr. Anwar, how frequently do you use your wash? Is it every day, twice a day, twice a week? Is it as needed? Is there a particular way in which this is introduced?
Sure. The products are designed to be used once a day, and you can use it, if you're very active, I would recommend using it 1 hour after exercise or, significant physical activity, but usually in the evening, once a day. And if there is a problem and the problem calms down, some of the patients go to every other day, but it's basically your end of the day cleanser.
So it can't be used every day, so that's very good.
On the shampoo, you would use it maybe 1 to 3 times at the most per week because we don't want to over-dry the scalp.
Okay, good, very good. In terms of patients with ichthyosis, there are certainly patients who have one type of ichthyosis called ichthyosis vulgaris, which is in itself commonly associated with atopic dermatitis. And it makes sense to me that this large group of people with ichthyosis vulgaris could get benefit from this problem, benefit from CLN wash, as they could from bleach bath, which probably their dermatologists have already recommended since this is something from birth. But the other forms of patients with other forms of ichthyosis could benefit from this as well. Patients who have Netherton syndrome, which is very much like eczema in terms of the intense itching and flaking that they have, are also colonized with staph, and I think could benefit from using this wash or bleach baths. So that's this product is basically reducing the amount of Staph aureus on the skin. It doesn't cure ichthyosis. It doesn't cure atopic dermatitis, but it makes problems easier to deal with and easier to handle if they are in some way related to an overgrowth of Staph aureus. So it's not a cure, but it's a treatment that could help manage. I think that there are other patients who have other forms of ichthyosis where this could be beneficial as well. Patients who have epidermolytic ichthyosis, or EI, or some patients with lamellar ichthyosis where the skin is very thick have a problem, I know, with body odor, and that's usually due to an overgrowth of bacteria that may or may not be related to Staph aureus, but I can imagine that since an oral antibiotic from time to time might reduce odor, that something as simple as using CLN wash would give you the same result. In my own practice of general dermatology, when some child comes in with smelly feet, or a young person comes in who's 10 or 11 years old, who is just starting out with puberty and has developed body odor, I think that, or axillary body odor, I think that CLN wash works very good for reducing that, that problem. The other, I'm trying to think, the other thing that I think that this would be good for in ichthyosis is certainly overgrowth of staph germs and infections and itching. A lot, I think when I was at the last conference, that was a major problem that so many people were plagued with, is the itching of their ichthyosis. And we know in patients with atopic dermatitis who have staph, the staph on the skin is something that makes itching worse. the staph on the skin has enzymes and components of their cellular makeup that will actually induce itching. So although it's certainly not a panacea, I think that in theory we might be able to reduce itching somewhat in the patients who have ichthyosis. Now this is all, I will say, theory and anecdote, because we have not really studied patients who have ichthyosis and itching with this product, or even with bleach baths for that matter. But to me, I'm making a jump between my patients who have just atopic dermatitis and staph over to the ichthyosis realm, and thinking that it may be useful there as well. So the three places where I see it useful are true Staph aureus infections, which many patients with ichthyosis can get, body odor, quite possibly, and itching, which seems to be almost a universal issue in our group of ichthyosis patients. So I'm really hopeful that bleach bath or clean wash, depending on the age of the patient who has the problem, will be useful, and I think you know, we have to wait and see, but it's certainly worth a try for an over-the-counter product that is essentially non-toxic, that avoids the use of antibiotics when we know we do have an infection that's present. And those were the points that I wanted to make, and I'd be happy for anyone to chime in, either to ask me questions or if I have forgotten issues that may be important to them, that this product might help. So I don't think I know I didn't have any slides. And did everyone hear this?
I heard. I don't know if I'm on mute.
Did you hear?
Yeah, I hear you clearly, and I've learned a lot. Thank you. That was very good. I did have a few slides there, if you wanted to refer, to it.
Well, I do believe. I think it might be Cynthia that had a question.
Is that? Are you talking to Cynthia?
Yes.
Oh, great. I didn't know if I was muted or not. So I really appreciated getting this information. I'll tell you a little about my story, and then I have a couple questions. So I have lamellar ichthyosis, fairly severe, but I have 2 creams that keep it pretty nice. But I'd had some palmar involvement the last, I don't know, year or so that I hadn't ever had before. And when I got the samples of the CLN cleanser from first, really, I didn't think they'd apply to me because I hadn't had any infections. I didn't think I ever had got infected. I'd never used bleach baths. I don't think I needed them. So I put it aside, and then just so happened I had to take care of some wounds from surgery, and I was supposed to have clean hands or gloves to redress the wounds. And I saw that cleanser, and I thought, well, that'll give me really clean hands. So I started washing my hands with it every time I changed the dressing, and sometimes even throughout the day. And after a while, I noticed all that palmar involvement was gone, and my palms looked fabulous. And so I thought, wow, I don't know why that worked for me, but I love it. So then I decided to do kind of a test on my forehead and use the clean wash on one side and just get the other side wet the way I usually do. So I treated them both the same, except for that because I don't usually use any soap hardly. But I got them wet the same way I always do before I moisturize, and then I put the clean wash on the right side of my forehead, and it's improving. And I actually am glad to know I'm supposed to leave it on for 2 minutes, because I thought that I saw somewhere that it was 9 seconds. And so
maybe 90 seconds.
Oh, 90.
90.
Got it. Okay,
Yeah.
so I haven't been, well, so I really haven't been leaving it on the full amount of time, and I'm still getting results. So I'm looking forward to changing that. But I think it might be helpful for my whole body. I have this, you know, the ichthyosis on my scalp, my neck, my trunk, parts of my arms and legs, and I just have to, now that I'm kind of sold on it, use it and see how much I have to use it and what it does. So I am excited about it. And my one question, I just got some shampoo. I didn't know if the shampoo would work as well as the body cleanser, if I should use the body cleanser on my scalp. So that's one question. My other question is if there would be any discount for first people, because it's expensive and we have quite the skin battle to go through.
Those are great stories. That's really fantastic.
I'm grateful for First for sending that. I would have never thought it applied to me, and thankfully there was just a reason for me to use it, and I saw some great results. So I hope other people will try it. That's kind of my takeaway from this, even if they think they don't need it.
Yeah, so let me chime in. Dr. Anwar, thank you for those comments. First of all, I think at the end, Jamie and the team will provide a nice program with coupons for the First members.
Cool. Thank you.
I've told the leadership of First that we will do anything we possibly can to be a good partner to the First members in any way possible going forward, too.
Thank you.
As far as the timing on your skin, we've found that if there is more infection and odor and bacteria involved with the issue of the skin, then the longer the product is on the body, the better. And there are occasions that I recommend people even put it on before they get in the shower. There's a condition called folliculitis. There's another hidradenitis, you know, where it's more bacterial driven. And 2 minutes is a really long time in the shower, honestly, because we a little timer and we know we have kids in it and so on and so forth. So 2 minutes is an eternity. So I say in the problem areas, body odor, et cetera, just apply some of it on before you get in the shower, brush your teeth, do whatever else you need to do, drink a cup of coffee, then get in the shower and then lather it off. And so that's another little trick. The other thing we found is that people don't spend enough time on their legs, the lower extremities. The water is just running down there. So turn the water off in the shower while you're lathering the product on. So wet it really well, turn the water off completely so that you have good contact time on the skin. Now, if your skin is super dry, you know, you may want to back off a little bit on it, and you could go to every other day or have less time on it. But if you want to kill more microbes, the more time, the better.
Got it.
And as far as the shampoo is concerned, the shampoo has the sodium hypochlorite, but it also has salicylic acid. So I would consider the shampoo a little bit stronger, but it also feels different. It's got some glycerin in it, so it's a little moisturizing in it. And it has a little bit of a medicinal smell to it. So I would not use both of them. I'd use either or. Either or on your scalp, and you just need to experiment with it to see what suits you better. And if your skin is you know, very dry, maybe the salicylic acid may be a little bit irritating. But you know, you just have to figure it out on your own. And we have found that a lot of the First Foundation surveys show that, you know, they like the shampoo as well.
Yeah, thank you. That's helpful. I like your idea of just putting the body wash gel on your skin, and I might just do that on my scalp, put some on my scalp before I even wash my hair.
Yeah. Now, do you color your hair? Or?
I do, but not on my scalp. I'm very careful. They use foils. Keep it away from my scalp. I don't want the color to touch my scalp.
Oh, okay. Yes.
Is there any time, Dr. Anwar, is there any time where where you mentioned, do you use any other products like hair dye? Is there anything that would prevent someone from using your products? Other than being allergic to them.
Yeah, no, you're right. If it's if they get right, no, we don't really find any situation that that you wouldn't use it.
The reason why I ask that is because there are some acne products that will turn your skin color brown when you mix them together with other acne products. You don't have any. You've not heard of any issues with.
No, we've had probably several 100,000 uses, and no issue there. The main thing is keep it out of your eyes. You don't want to get it in the mucosal surfaces. Don't use it as a female hygiene product. And I think the other area, if there is a lot of if patients are itching, I want people to pay particular attention to their nail beds. Trim them and get a scrubber and nail and really clean the nails, because at least in eczema populations, as many as 94% of them carry staph under their nail beds. So that staph is being spread around by the itching.
Good point.
Have you noticed any of this cleanser products helping with the regrowing of hair or anything like that?
No, we have not used. We've not seen that. No.
Okay.
Well, I will be the first to try it because, if you know me, my plumage is very thin up top. So I'll give it a go and let you know.
Likewise.
Have you seen any difference between your product and the bleach baths?
Well, I think there are differences. First of all, in my experience with bleach baths, I had to rinse off after I got out of the tub. I had to rinse off to just get that smell off of me. Right. I think a bleach bath is more drying, and the bleach bath is not recommended to be used above your neck. And oftentimes there are a lot of problems above the neck area. And I think for children, it's just a less hair-raising occasion for the moms or parents to prepare a bleach bath versus using ours. And also in the elderly, getting in and out of the bathtub is a little bit difficult. But believe me, if a bleach bath is working for you and you can do a bleach bath, it's so much cheaper. That costs pennies versus our product.
Well,
you have to stay in a bleach bath for 15 minutes in order for it to work. That's what's suggested anyway.
Yeah.
I never had any luck with the bleach bath, and I found it to make my skin like slick. So I didn't like it, and like I said, it didn't really work for me. I kind of thought it was a little humiliating when my doctor told me to try that. So I guess now it's not as bad now that I know other people have been using it. But
yeah, it's probably one of the best things that you can do to your skin is doing a bleach bath. And it's also recommended by other doctors when they're trying to reduce the bacterial load on the skin. People carry staph bacteria on their skin and have had repeat infections. The infectious disease doctors recommend bleach baths as well.
Okay. Is there any difference with, I guess you did say something about, what is it? The foot fungus or dealing with foot issues? It helps with that also? Shown to help with that?
Yeah, so with I think, Bob, you ought to explain the foot fungus between the nails and just athlete's foot.
Right. Well, I don't, Dr. Anwar, I don't think we yet have any data, unless, correct me if I'm wrong, about whether or not bleach bath or CLN wash will actually reduce a foot fungus, because a fungus is a different type of germ than Staph aureus. Now, foot fungus certainly can itch. Foot fungus can be red. Foot fungus can be scaly. Foot fungus can look very much like the pictures that were on the webinar here of a staph infection on the feet or on the hands. Unless your dermatologist does a little special scraping test, they would not be able to say that a particular appearance is really a true fungus. Now, it may be true that CLN wash for bleach, which has bleach in it, will reduce fungus as well. But honestly, I don't know that has been shown or documented yet. And that would be a great project to do. And if it works, that's super. I would highly doubt that it would do anything for nail disease. One of my other specialties is nail disease, toenail fungus, and I think that it would be wishful thinking that a bleach bath or clean wash would do anything to a fungal toenail or fingernail. I do like the idea of, when you're washing, that might be the only time to use a brush would be if someone does have staph to foam up and brush under the nails to make sure there's no staph that's under there. But again, I don't think we have any information about fungus as opposed to staph.
Yeah, I agree. As far as the nails, if there's an infection, a fungal infection in the nail, then that's
got to be treated totally differently.
Orally, and it's going to take months and months for that to benefit. We have anecdotally seen that just the skin problems of athlete's foot is in jock itch and all those things are improved. And then, at least in the test tube, fungi are killed by our product. But we've not done a formal study like we've done in eczema. And there are a number of other studies that we need to do besides eczema with our, with our product. But certainly not with. I would agree that this would have no effect on the nail bed. I do think that once you treat the nail fungal infection, to include clean as part of your hygiene protocol afterwards, because you get reinfected pretty easily, and you can get athlete's foot and have the webs of the feet get infected. It may be useful for that, and that's what we're told anecdotally.
Okay, thank you.
Mm-hmm.
Hi, I have a quick question. I have a son, he's 3 years old, and we battle with scalp. He itches really bad on his scalp and other places as well, but he does have lamellar ichthyosis. Out of the product line that is on the screen now, which ones would be better to use for him or try on him because of his age?
At a 3-year-old, I think using a 3-year-old with a scaly scalp, I think using either product is fine. I know there is a theoretical risk when you expose someone to salicylic acid in terms of absorption and possible toxicity, but a 3-year-old's body surface area is large enough, and the location where you're putting the clean wash, if you're just using it on the sal acid product on the scalp, is not going to, should not be toxic at all. The eye issue is totally separate, but if you have scaling and itching in your scalp, I have no problems with using the sal acid at that age. If, on the other hand, if there's someone on the line who has an infant who is 1 or 2 or 3 months old, that's a different story. I think they are young enough that their skin is thin enough that that any type of salicylic acid product could be an issue. And when I'm seeing infants in the nursery or infants who are, 1 or 2 or 3 months old, when I recommend lubrication for those children, I'm using emollients, but no salicylic acid, no alpha hydroxy acids until the kids are older.
Okay. Thank you.
3 should be fine.
I look forward to trying the product.
I'm sorry, I didn't understand that. Could you repeat that?
Yeah, I just said that I look forward to trying your product.
Oh.
Dr. Anwar, we have another question coming in from Facebook. So it appears to be someone who's a fan of the products, and they want to know if you would be willing to offer a larger size bottle for their larger needs. So I guess they are looking for a bulk size bottle or a family size bottle for specifically the antifungal wash and shampoo. So is there anything in the works for that, or is that something you would consider doing for the ichthyosis families?
Sure. So just a little trick. The body wash is 8 ounces that's available online, and the sport wash is 12 ounces. The sport wash and body wash are the similar formulation, so I would just order the sport wash. That'll give you a 12-ounce bottle of the same product, and so that'll help. Were they thinking of a like a gallon jar, or just?
I don't know.
Yeah, I would say.
But probably it sounds like someone who uses the product quite frequently, and it may even be for multiple people in the family.
Right. So I would say the CLN Sport Wash would be their best bet, and if we had an idea, for instance, of how many bottles a family would use in a month, maybe we could come up with a special program for the First Foundation.
Oh, that's great. I will definitely let them know.
Okay. Any other questions?
Will the presentation be available on the FIRST website?
Yes, we are recording this presentation, and we'll be posting it early this week. We'll send out an email letting you know when it's available.
That's great.
Would 3 bottles of the 12-ounce, would that last the family a whole month?
Well, Dr. Anwar, I think one question when we met at the Academy of Dermatology was about how much a person should use of the body wash. And I think if you could just quickly answer that question, because I think I was actually surprised at how little you placed on your hand to say that that would cover your the whole body.
Sure. Yeah, that's a really good question. Just in way of background, when we first brought the product out, we brought it out in very small bottles. There were 2.5 ounces and 3.4 ounces in a meter dose and so on. So we were thinking that people would just use 2 to 3 pumps, which is a very small amount. Each pump was, I think, 0.8 mils or less than 1 1 ml. And so I think that if you put the body wash from the larger bottle, from the 8-ounce bottle, it'd be the size of a dime, maybe, or a little bit more than that. Should cover, you know, your face and upper arms and neck, and so a little bit of it goes a long way. But the key would be to really, really wet the skin ahead of time and learn how to use the product in the most economical way by using a little bit, wet the skin, and then really work it into your body and lather it. You'll be surprised how much body surface area you'll cover. Now, if you just pour the bottle upside down and just squeeze it, obviously you're going to go through it really quickly. And I would say experiment on your own with very wet skin, just how little you can use and take advantage of the time being your friend. Wet skin, spread it all over the skin, and keep it on a little bit longer. You'll get tremendous efficiency from it. I'll use a 12-ounce bottle of Sport Wash, and honestly, I cannot finish it in 2 months. It lasts so long. Now, for the ichthyosis patients, since you're washing every inch of your body with it, perhaps, then, you know, it may not last as long as it does for me. And if you're having, and I don't think you need to use the product on your entire body, too, if it's not having problems.
Should we actually see dirt come off when using this product any more than we would with like an Axe body wash?
I don't think you will see any difference in what comes off. We think that the microbes that are playing a role are just, you know, completely not, you know, visible to the eye.
I see. So this is more, I was thinking of like there's products that, you know, claim that you can clean your face with them, and once you wash your face with something else and wipe your face with their product, you'll actually see dirt come off. I was just wondering if that...
Actually, no. Our product will absolutely be the best for that. You know, the body wash or the Sport Wash will, you will see no residua, none of that dirt on the cotton ball after you wipe down with it.
Right.
So the body wash will wash you cleaner than Axe for sure.
Okay.
It may also have to do something with biofilm. Now we're getting into the weeds, but staph bacteria, when it goes on our skin, within a very short time, within 30 to 60 minutes, creates what's called a biofilm. It's like a saran wrap embedded with bacteria that wraps itself around and becomes harder and harder to remove from the skin. And when that biofilm plugs up pores, it leads to more itching. So that's why really working the product and scrubbing and all this and that and using clean is going to get you cleaner.
This is the first time I've heard about a biofilm. Can that actually become a visible sheen on the skin?
I don't know that it's visible. Bob, can you?
Not that I know of.
Yeah.
Not a visible sheen, no.
Okay.
I don't think that's been, I've never read that it has, nor have I seen it. in nail disease, you can, there are certain presentations of a nail fungus where you could predict that there would be a biofilm that was there. Biofilm is a word used by researchers that indicates that if you have a lot of a germ, the inner layers of the germ, like the inner layers of, say, an onion, are not as prone to being killed compared to the outer layers. In other words, the outer layers are doing something to protect the inner layers. And I don't think you could really see that on the skin per se. Not like a film you could kind of scrape off with a butter knife, if that's what you're thinking of.
I just noticed that I have like I guess a sheen that's new to me. I hadn't noticed it before when I was in my like in my 20s. So, and since I started getting these infections, I thought that might have. So.
Well, if you have a dermatologist who is in your area that is on the ichthyosis medical board, a medical advisory board, they might be interested in seeing what you are observing.
Thank you.
Would you like for me to review the slides that are flashed up there? Because I think Dr. Silverman did not have access to the slides.
Sure.
I can flip through those and just speak to them since you're going to be putting this on your website. Please go back one slide. All right. Again, Dr. Anwar, and this is the entire line of our cleansers. And the most versatile products are the body wash and the sport wash. And the body wash is 8 ounces and the sport wash is 12 ounces, and you can use those interchangeably. And then we have products with sodium hypochlorite plus salicylic acid to the right-hand side. And probably the most useful of those products for the ichthyosis community will be the CLn Shampoo. On the left-hand side is the shampoo without salicylic acid, but it does contain glycerin. Next slide, please. We believe that the 2 best products for the ichthyosis community are the body wash and then the shampoo, which I'll go over in just a minute. The body wash can be used in children in 6 months and older. And it's designed for those that are prone to infection, eczema, dermatitis, ichthyosis, and things that we've talked about already. We have noticed improvement as early as 3 days in our clinical studies with eczema. The product does contain sodium hypochlorite. The pH is 7.8. Whether that makes any difference in your life, I'm not sure. And the products are available in 2.5 and 8 ounces. And I mentioned earlier, the sport wash can be used interchangeably, which is 2 ounces. Next slide, please. The CLn shampoo would be the second category of products that will be useful. It has sodium hypochlorite and a very small amount of salicylic acid, and it's designed for skin and scalp that's oily and prone to folliculitis and dermatitis and dandruff. It has glycerin and other skin conditioners in addition to salicylic acid, and it's preserved with sodium hypochlorite, as we mentioned. The pH of this is 6.3, and we don't recommend this shampoo on a daily basis, although a lot of people are using it on a daily basis, and this product can be used on your body besides your scalp. But if you're just washing your hair with it, I would use it 1 to 3 times per week so that you don't over-dry the scalp. And this is available in 8 ounces, and I think this should, if it's just used as a shampoo, quite a long time, 2 to 3 months at least for you. Next slide. We just have some information where the body wash is used for a lot of common skin conditions, and I'm not going to go over all of these, but just on the tips of using it, again, leave it on for 2 minutes, lather it on for 2 minutes on really wet skin and rinse it off, and then you can apply anything you want. And in certain situations, you may apply it before you get in the shower, as we discussed earlier. I recommend that you use this either at bedtime or after significant sports activity, but usually after, just getting yourself really cleaned up at nighttime and then putting on some nice cotton clothing afterwards will give you, I think, the best results. And again, pay attention to the nails when possible. Next slide. The other category that this product is used for a lot is those for risk of infection, and you would still use the chlorhexidine as per usual for surgery, but if any of you will go through surgery, 3 to 7 days prior to surgery, you can wash the whole body, the nail bed, skin folds, lower extremities, etc., and really get the body clean prior to surgery would be super helpful, especially if you've had prior infections or those of you that have benefited from bleach baths. I think going into surgery in a really clean way would be very helpful. A lot of times the surgeons do not give you enough information on what type of hygiene you should carry out prior to surgery. In certain surgeries in the lower extremity, abdominal surgery, or anytime you're getting an implant of a knee or otherwise, going in really clean would be super helpful. Next slide, please. And I think the Q&A, we've had that. Next slide, please. Jamie, do you want to go over the coupon here, or somebody else from ichthyosis?
Yeah, this is Jamie. I'm happy to. So in support of Ichthyosis Awareness Month, we have a special for those who have participated in this live webinar, or if you can pass this along to your other members or people that you feel are interested, if they've reviewed the recorded program, please let them know that we have $10 off of every bottle of clean body wash or the shampoo. You can go online at cleanwash.com to order that. And when you are ordering, just use the code FIRST10, and that offer is good through the month of May. The nice thing also is that when you make a purchase, you'll also receive a free travel bag, and we're going to be filling that with other clean samples for you. And then you'll also receive free shipping.
I'm sorry, my name is Elsie Pickens, and I came in about 20 minutes ago. I didn't want to interrupt. I've been with my niece. She's 13, and she has ichthyosis lamellar, and you said clean wash what? I'm sorry?
We were talking about the, for the offer, it's with the clean body wash, so the body wash or the clean shampoo.
Yeah, but what's the website?
Oh, I'm sorry. So it's cleanwash.com, and it's spelled CLNWASH.com.
Oh, I'm sorry. CLH.
No, LN as in Nancy, and then WASH.
Elsie, this is Maddie from First. We'll also send an email out tomorrow morning that has a link to the website, the coupon code, and also a chance for you to review the rest of the website that you...
wonderful, wonderful.
Yes.
Perfect. Thank you very much. I just want to listen, that's all.
Wonderful. Well, we really thank Dr. Anwar, Dr. Silverman, and Jamie for joining us this evening and for talking to us about their products and also for offering this amazing special to our members in celebration of Ichthyosis Awareness Month. So thank you very much for joining us, guys, this Sunday evening. And we'll be sure to promote this, send this out to you guys. And if you have any questions or anything, please feel free to contact me, Madeline, at first. And we really thank you guys for joining this call tonight.
Thank you.
Thank you. And one last point, on our website, we do have a shop by concern section, and we have a special section for ichthyosis for your benefit.
Wonderful, wonderful. Well, thank you very much, everyone, for joining us, and we hope to see our members at a future Patient Support Forum meeting at the National Conference or on another First Snow Call or participating in our national fundraiser. So lots of ways for you guys to continue on being involved, and we just thank everyone for spending their Sunday evening with us. So have a great night, everyone.
Thank you.
Thank you.
Thank you.
Okay.
Bye-bye.
Bye-bye.